Be here.
Morning, this is Ian Doyle, Board President of the Oregon Board of Pharmacy. I will now call this meeting of the Oregon Board of Pharmacy to order. Today is Thursday, December 14th, and it is 8:30 a.m. Board of Pharmacy meetings are conducted in accordance with the Oregon Public Meetings Law. Under the Public Meetings Law, governing body meetings are open to the public except as otherwise provided by law. The presiding officer has the authority to keep order and to impose any reasonable restrictions necessary for the efficient and orderly conduct of the meeting. Governing bodies are authorized by ORS 192.660 to meet in executive session in certain limited situations, including the consideration of information obtained by a health regulatory board as part of an investigation of a licensee or applicant conduct. All official actions by the board must be taken by public vote, and the vote of each member must be recorded. At the beginning of each meeting day, we remind ourselves of the mission for the Oregon Board of Pharmacy. That is, that it serves to promote and protect public health, safety, and welfare by ensuring high standards in the practice of pharmacy and through effective regulation of the manufacture and distribution of drugs. We'll now call roll for board and staff. For the record, when I call your name, please verbally acknowledge here. For President Ian Doyle, here. Board Vice President Kat Chin.
Here.
Board Member Shannon Beeman.
Here.
Board Member Rachel DeBarmore.
Here.
Board Member Jennifer Hall.
Here.
Board Member Rosemary Hemmons.
Here.
Board Member Rich Joyce. Here. Board Member Priyal Patel.
Here.
Board Member Cindy Vipperman.
Here.
Chief Compliance Officer Joe Ball. Here. Pharmacist Consultant Jennifer Davis.
Here.
Compliance Director Brianne Everhoff.
Here.
Compliance Officer Cheryl Fox.
Here.
Executive Director Jamal T. Fox. Here. Office Manager Naomi Graham.
Here.
Licensing Manager Chrissy Hennigan.
Here.
Compliance Secretary Elizabeth Hughes.
Here.
Compliance Officer Jane Lee.
Here.
Administrative Director Karen McLean. Operations Policy Analyst Rachel Melvin.
Here.
Compliance Officer Brian Murch.
Here.
Compliance Coordinator Kim Oster.
Here.
Compliance Officer Aaron Richmond.
Here.
Compliance Officer Gary Runyon.
Here.
Board Counsel Joanna Tucker Davis.
Here.
President of Pivotal Resources Pete Pandy.
Here.
Facilitator of Pivotal Resources Brittany Sale.
Here.
There will be an opportunity for public comment on Friday afternoon. The board will not deliberate any issues or requests during public comment, such as formal requests, issues currently under investigation, requests pending before the board, or currently proposed rules. To sign up to provide public comment, email your request to pharmacy.bop.oregon.gov by noon on 12/15/23. The board will meet in executive session this morning, starting around 10:10 a.m. and will resume open session at 1 p.m. And speaking, board and staff, please identify yourself as board or staff member, followed by your last name each time you speak. Please silence all your electronic devices. It is extremely important that board members speak one at a time and directly into the microphone. Please limit side conversations as they interfere with the recording. Raise your hand when you have questions or comments. Please note that this meeting is being recorded and concerned for public meeting purposes. We will now receive an update regarding the strategic plan with Executive Director Fox and Facilitator Pandy. These are mailings number A and A1. Fox.
Thank you, President Doyle. Good morning, board members, staff, and those in attendance. The item before you this morning is to draft goals and key actions for each of the Board of Pharmacy strategic pillars following the board's 2023 strategic planning meeting that was held last month on November 8th and 9th. Today I have members of my leadership team as well as members of Pivotal Resources who are the facilitators for your strategic plan and our DEI work. I want to thank both Facilitator Pandy and Sel for joining this meeting virtually, and I will turn it over to them shortly to go over each of the 6 pillars. Staff have been very busy over the last month, and in particular, we recently had a one-day staff strategic plan work session to compile the information we received at the strategic planning meeting in preparation for this board meeting as directed by staff. Staff are presenting the board's consensus upon priorities from the exercises the board went through during the strategic planning meeting. If you remember the various flip charts around the room, discussions throughout the strategic planning session, and the green dot exercise that you went through, staff intends to gather more feedback on any specific goals and actions outlined to synthesize and organize the strategic plan document to meet both the will of the board and in preparation to send to the Department of Administrative Services as outlined in the governor's strategic initiatives and enterprise accountability expectations regarding agency strategic plan reporting requirements. Board's vote on this document at the end of this next hour is necessary for staff direction as we work towards developing the final document for your review and adoption at your February board meeting. Today, we will not cover other proposed revisions or language to the strategic plan document. For example, the values and vision statements, as well as including an equity statement. As the board directed at the strategic planning meeting, staff will bring that information back for the board to discuss and consider at your February board meeting. As we get into sharing what we gathered, I would ask the board to consider for the current strategic planning process, what has worked, has not been successful. Have we been strategic, intentional, and focused on both the current climate and future opportunities? Is it effective or efficient to adopt a plan and then each year, whether odd year or even year, you're making changes? Board meets one day a year in November to discuss the strategic plan. Would that be necessary if updates were provided throughout the calendar year? I will also share for the board to consider, does the length of the strategic plan make sense every 4 years? Generally, it's used to be in 5 years. But I believe that how most organizations have reverted to 3 to 5 years due to drastic changes in the market. We'll also consider how we streamline board meetings to be more efficient from 3-day meetings to possibly 1 to 2-day meetings. Understanding the board's appetite to consider reimagining how we conduct strategic planning and the board's vision for the future will help staff's effort in meeting the board's goals and priorities. Now I'd like to turn it over to Facilitator Pandy to walk us through each of the 6 pillars and ask the board to hold any questions or comments until after each individual pillar has been shared. At that time, our facilitators and appropriate staff will chime in to answer any questions you may have. Facilitator Pandy, please take it away.
Thank you very much. This is Facilitator Pandy. Thank you, Executive Director Fox. And good morning to all of you. Glad to see you all again, even remotely. So as Executive Director Fox noted, we've done quite a bit of synthesis of the input from the meeting in November in Newport. And today we're going to share the outcome of that for your comment. The document that you're seeing on the screen currently is a synthesis, or basically a checklist that we put together that staff member Fox did the first pass, and then we used it to kind of make sure that the various items that had been brought up in the strategic plan meeting were captured in some way in the strategic plan draft, or the goal and actions draft that we're going to go through here in a minute. But just wanted you to be aware that we were paying close attention to the input that we received from the board in putting together the synthesis in changing the language and reorganizing things a little bit to fit the structure of goals and key actions. It might not be possible to see everything precisely, and we, use different language. Some of the things that came up, for example, in the first one here under licensees, some of that we felt fit better under communication. So I'm not going to go through this document, but just to call your attention to the fact that there was an alignment with the input that was given by the board in the document that we're going to share. So I think what we can do now then is go to the actual draft. You've had a chance to look at this, hopefully. I know you have many things to review prior to meetings. But what I'm going to do here is basically just kind of skim through the goals and key actions that were developed as a draft under each pillar, and then open it up to each of you, or actually to the full board, to make comments. I'm not going to do a round the table for each one of these because we want to keep this efficient. So if you have any comments or questions on these, please speak up to be recognized, and then we'll have you make a comment. So you don't have to make a comment. By not speaking, we're going to assume, though, that you're comfortable with the draft that's here. We also want to get away from a lot of wordsmithing. Obviously, if there are specific terms you have concerns with, please bring those up. But as we go forward, we'll give you a chance to make more specific comments on the language, but we don't want to get into a wordsmithing draft here. It's more, have the goals and the actions that have been developed, do they reflect the direction that you feel you as a board provided to staff in the meeting in November? Any questions on this process before we go into the nitty-gritty here?
Board Member Doyle, I do not see any hands.
Okay, great, thank you. And again, please, if you have a question or concern on any of these things, don't hesitate to speak up. This is our chance to hear from you. All right, so under licensees, these are the people that are licensed by the board. We had two main goals. One is to, and I'll go through the goal and action for each one. So the goal, just to make clear, that's sort of the broad intent, and then the actions are things that we would do to achieve that broad intent. So it's, where we want to go and how we want to get there. One is to promote promote deployment and effective implementation of new licensee rules to ensure they achieve intended outcomes. Actions are to monitor questions, concerns, and impacts of updated rules to assess effectiveness and identify any unintended consequences and/or need for clarification. And then 2, take action as needed to amend and refine rules to ensure clarity and achieve intended results. Second goal, enhance and/or support factors that can positively impact the well-being and ability of licensees to safely and equitably serve patients. Key actions are to collect and analyze data to gain insights into trends, challenges, and opportunities related to licensee diversity, job competence, and satisfaction. Collaborate with and learn from professional associations, other agencies, and employers to build and sustain licensee competency and promote their ability to effectively serve patients. And 3, support licensee access to and prompt utilization of resources to address behavioral and mental health service needs. So those are the goals and actions that we're proposing under licensees. Comments, questions, concerns? All right. Not hearing it. Okay.
No hands raised.
Great. All right. Well, then let's move on to, and if, as we go forward, if you think of something, well, back on licensees now, I'm not so sure that's, we're not, when we pass this, it doesn't mean, you can't go back. So the next pillar is registrants. And this was one of the areas where we had some definite give and take on, how do we handle this broad topic of registrants? So what you'll see here is we're really talking about registrants in, 2 broad categories, and then some things that relate to all of them. So the first is to amend existing rules for pharmacy registrants. So that's specifically pharmacy registrants to clarify categories and operating standards, support safe and equitable access, and avoid unnecessary administrative effort. And so the actions establish clear goals, priorities, and a high-level plan for the pharmacy registrant rule revision process. And 2, evaluate and refine each proposed rule change to minimize compliance challenges while prioritizing public safety and access to medication. Second is update rules for non-pharmacy registrants. That includes manufacturers, wholesalers, third-party logistics providers, drug distribution agents, and non-prescription drug outlets to address changes in federal regulations. And actions there include harmonize existing rules with updated federal regulations to ensure consistency and alignment, and identify and address gaps in state rules to mitigate risks to patients, support efficient drug distribution, and provide clear operating guidelines for non-pharmacy registrants. And the third goal, utilize the board's platform and expertise to help address registrant-related obstacles to equitable access and potential patient safety risks. And the 2 actions here are to engage with, actually there might be 3 because I can't see the page. Sorry. No, that's just through 2. Engage with public and other interested parties to identify individuals, groups, and locations facing obstacles to accessing pharmacy services. And 2, continue the Safe Pharmacy Practice Conditions, or SPPC initiative, considering enhancements to promote diverse representation and to more effectively address safe practice challenges. Those are the goals and actions under registrants. Comments, questions, anything missing from what you thought you were asking for? All right, I'm not going to wait a long time. Go ahead.
Member Bipperman. So I know somewhere in our iPad, there is the pictures of what we had on at the meeting. Can somebody tell me where that's at?
Staff member Melvin, that's going to be in your November 2023 folder.
Oh,
And there's a specific folder with pictures of every
It's not in
flip
the
chart.
Strategic plan. That's where I'm looking.
It's in the, no, not in the December meeting. You have to go back to the November meeting.
Okay, just, I went to resources and I thought it would be there.
Hmm.
I just want to make sure that, we're capturing all that was on that, all that was important to us, that's on that paper. Is anybody else looking at that? No, I would like to look at that. So I'm gonna look at that and then, thank you.
All right. So there's a lot of material there. So are you okay, Board Member Vipperman, if we move in, if there are no other questions and you can review those later? I mean, this is not your last opportunity to speak, but this is the chance for you to do it as a full group.
This is Board Member Bipperman. Yes, I'm good with moving forward as long as I can go back.
Okay. You can. All right. So this is consultant or facilitator Pandy, and any
No.
other
I'm
comments?
sorry, we have another hand. Sorry.
Yep.
Board Member Hemmings, just for clarification, just had a thought, Board Member Bipperman said, so this is a summary, what you're presenting is a summary of what we actually worked on in November, correct? It's not necessarily, doesn't necessarily capture everything that we actually requested. It's just a summary of much as possible that captures what we suggested, correct?
Executive Director Fox, Board Member Hemmings, what's being presented is the staff's best effort to synthesize information, which is exactly what was stated from what was believed as the consensus through your green dot exercise that you did last month. So this is verbatim. Basically, what we did was take on the sheets around the room, took that information based off of the green dots, synthesized it. As facilitator Pandy stated early on, there may be some different vernacular used throughout, but it's basically exactly the consensus that we saw from when you guys went around and rated the green dots.
Thank you, Board Member Hammond. I'm a little bit, I guess I would probably need to go back and take a look at what Board Member Vickerman is doing. Because maybe I'm missing something and maybe it's not where it goes, but I don't see anything here in just the two that we've discussed that even mentions anything about equity. I saw the word diversity in licensee. But I didn't see anything related to equity, so I'm not sure, maybe it doesn't belong here, but just want to clarify.
Well, as noted, the synthesis is breaking down the actions under each pillar. And I think part of the objective was to make equity, diversity a key element of each pillar. So I think these are just so far we've just seen 2 of the 6 pillars. If through the going through the rest of this, you are still feeling, oh no, we haven't captured that enough, then that's something that we can look at. But we certainly kept it as a key objective, and it comes out more more specifically in some areas than others. But just looking on the page here, we're talking about safe and equitable access. We have diversity reflected in others, and it's going to come up again as we go through other areas. But part of the goal is to figure out where can we specifically take action on diversity. So I think in this case, we're trying to integrate it into, these are the things we need to do as a board, and here are opportunities where that the diversity, equity, and inclusion objective can be specifically furthered, if you will. For example, the SPPC, to think more about how do we get the right people involved in that process so that it can be, reflect the board's overall equity vision. But agreed, it doesn't come out, it's not a one thing that's been presented when we break it down into the different pillars.
Board Member Hemmings, thank you for that clarification. I am seeing that in the goals in terms of equitable access. I guess I was looking for a little bit more in the key actions that specifically speaks to how we get to equity. Because I know that especially in the rules, there's a statement on every rule that talks about equity, and I'm just kind of looking for, and I think I did state this during the retreat, that I think it's important that we include equity up front into everything that we do rather than it being an afterthought. And I don't see that here in the key actions, and I guess that's what I was looking for. But we can move forward.
Yeah. Well, I would just add that what we're looking at would probably be the 3rd section of the actual plan document. And then there would be other language expressing sort of broader background for the plan. So I think there will be other places in the document where you'll see that, but I think your point is something to continue to pay attention to. I'm sure.
Thank you, Director Fox and Board Member Hemmings and members of the board. This is your strategic plan, and so if there's additions that you would like to see staff go back and refine, this is an opportunity to give that direction to us. Particularly, there's 2 things, Board Member Hemmings, that you raised. Yes, with the equity, there's still work that needs to go into this, particularly when we send it on to DAS in the governor's office. And secondly, it is known that we need to not only embed equity through everything, but also embed the governor's initiatives throughout the strategic plan. So when we submit it, it has all of that in there as well. So hopefully through the next iteration, by the time this comes back in February, we'll be able to process and have a little bit more in there. But please, as we go through this, if there's things that doesn't make sense or you want to see us include more, please state that. At the end of this hour, the hope is that at least what we have here is a good start, so we can continue to flesh out these 6 pillars. So when we bring it back, there's something that you could review and actually support and vote on to adopt in the February meeting.
All right. Any other questions then, Board Member Hemmings? That sound okay?
Board Member Hemmings, yes.
Okay, great. Thank you very much. Any other comments? I haven't heard of any other hands going up, but just one last check. All right, so why don't we move then to the next category, which is innovation. And I'll just make the point that what we're looking at, what we intend to have in the final document, but we didn't finish the draft because it would be a lot of, there we would get into wordsmithing, is that prior to touching on the goals under each pillar, there would be some narrative about what do we really mean by innovation, what is kind of the current situation, what are some of the accomplishments that we have, and what are some of the current challenges. So there will be some narrative lead into this. It won't just be innovation goals. So, but we haven't finished drafting that, and we wanted to really focus on, because if you don't like the goals, then all that other stuff is sort of immaterial. So this is really the meat, if you will, of the plan. But there will be other text and explanation that will go with it. So goals under innovation. First is proactively assess and manage the impact of emerging technologies on pharmacy practice and patient safety. 1, monitor the adoption of innovative technologies in the pharmacy industry, evaluating their potential benefits and challenges in terms of pharmacy access, service, and patient safety risk. Identify areas where the board can act to facilitate the safe and effective implementation of innovative technology solutions, including potential modifications to statutes and rules. And 3, examine potential applications and implications of artificial intelligence in the context of the board's work and the overall practice of pharmacy, highlighting both advantages and concerns. Second goal is to explore and adopt innovative approaches to enhance access to board rules, information, and services. 1, continue progress in providing online informational resources and interactive tools to foster engagement with our customers, patients, and communities. And 2, collaborate with state enterprise and/or other agencies to leverage technology solutions and improve access to and quality of board services and information. For example, translation services for non-English speakers, ADA access guidelines, etc. Those are the goals and actions under innovation.
Board Member Hemmings.
Okay, Board Member Hemmings, so clearly here, I would definitely want to see a statement, whether it's in the key actions or in the goal, that speaks to how innovation can, impacts equity, or it creates inequity. I think it's a perfect place for that to be, and I don't see anything here that references that, except potentially, I see a space here in number 3, small 3, where definitely refer to AI, where we could definitely embedded something here about how it impacts equity or creates inequities. When you think about innovations, technology, I'd like to see that somewhere. in
Yes.
here. Absolutely.
Yes.
Thank
Very good. I was reading it. I was thinking the same thing. So that's a good input. We will look at that as a modification. Other comments on the innovation pillar?
Member Vipperman?
So I was wondering, I'm looking at the paper, the innovation priorities. Where does the technician education that we put on there, where does that fit in? It's not on there anywhere. It's not anywhere in the strategic planning.
I think it comes up in maybe in communication, but the specifics of technician education, I don't believe was a consensus direction from the board. It was mentioned as a concern and has been in the past, but it didn't come out as one of the everybody wants it things, I guess is the way I'd put it.
Member Hall?
Member Hall, I remember putting several stickers on that as well. You look at the image, I mean, that has the most.
Mm-hmm. Okay. Well, we'll look, there may be reference to it later because I don't have these memorized, but that's something then to be addressed. We can add that. We'll have to find a best place to include it. Other comments? All right. So noted. Let's move on then to our next pillar category, which is operations. So this was sort of one of the new ones in the pillar review that we did. So first goal is to address opportunities to promote efficiency and access to board provided services and support. And key actions, really just one with two elements to it. Continuously enhance the online information and tools provided to licensees, registrants, and the public, prioritizing user friendliness and accessibility. And then under that, regularly evaluate the effectiveness of registrant self-inspection forms and other guidance documents to ensure they remain relevant, informative, and easy to understand. And B, expand access to pharmacy in charge training and other high demand training programs. Ensure adequate tracking mechanisms are in place to keep accurate records of participation and completion. Now, there's a possibility we could make mention of technician training there as one clarification. I don't know if that would be helpful, but just as I'm reading that occurs to me. But I'll keep going with this and then we can come back to that. Second goal here is to ensure agency capacity, diversity, and capability to achieve operational and strategic priorities, deliver effective service to customers, and optimize resource allocation. And several key actions here. Conduct a comprehensive analysis of staff roles, diversity, skill levels, budgets, and organizational culture in relation to workload, priorities, and values. Implement realignments to staffing levels, roles, and responsibilities as needed to achieve key performance measures or KPMs. Promote staff diversity, foster strong morale, and deliver on key goals. 3, evaluate existing processes, procedures, and systems and software to identify and take action to streamline operations and ensure high-quality performance. And 4, support the governor's strategic initiatives and fulfill all agency requirements within the assigned timeframes. And 3rd, improve support for board member engagement and participation. And key actions here include strengthen and reinforce the board member and staff onboarding and orientation process, ensuring a regular review of procedures and responsibilities, and review the agenda build process to broaden input and provide flexibility in addressing emerging priorities. So pausing there, those are the goals for operations. Yeah.
There's also number 3 on the next page.
Oh, see, this is where I can't have memorized. Yes, that's right. Thank you. Develop and provide training on new board rules and procedures for meeting decorum using Robert's Rules of Order. I believe there's a note's been sent about that by Executive Director Fox.
Thank you, Board Member Hemmons.
Member Hemmons, I want to get this on the record, so I'm gonna, sound like a broken record here. But once again, there needs to be, mention of how this also may enhance equity or inhibit equity.
Mm-hmm. Very good. So noted. Other comments? Questions? All right. Not hearing any other comments. Let's move on to our next pillar, which is regulation and compliance. Big category. So the goals here include, first of all, continue and refine rule review and revision efforts, balancing patient safety goals with speed of progress, volume of changes, and board and constituent capacity. Key actions include proceed with the planned overhaul of rules governing registrants and implementation of recent licensee rule updates and reorganization. Expand opportunities for board review, discussion, and input on rule priorities, rationale, and scoping. Review current rule writing process and implement measures to ensure early, diverse, and thoughtful input from various interested parties, such as through outreach efforts, standing rule advisory committees, board standing committees, and other approaches. And 4, under this, continuously monitor the impact of new rules on safe practice of pharmacy and gather feedback from licensees and registrants. Take action as needed to refine rule writing and format. Second, under this, and by the way, the numbering is really just for reference. It doesn't, it's not A is more important than B. We just use the letters. So if we need to talk about which one are we talking about? Well, I'm talking about, number B or goal B under registration and regulation, or regulation and address causes and impact of significant growth in case and complaint volume. Key actions: conduct thorough fact-based review and analysis of cases submitted for board adjudication, identify patterns and root causes by source of case or complaint. Based on analysis and ongoing review of case trends, take appropriate mitigating action. This may include providing information for licensees and registrants to avoid violations, adding resources and/or adapting processes to manage case volumes. Continue steps to improve organization of case information for effective board review, and design and implement an enhanced case tracking process to improve monitoring and response to trends and compliance issues.
Member Hemmons.
Member Hemmons, same comment before, I see a lot of, cases here where equity could have been, added, so I'm happy to work with whoever's working on this, but yes.
All right, good. So noted. Thank you. I can see where you're coming from. Other comments?
Member Patel.
Board Member Patel, so I just read on the goals and A, number 3. And that one, it says, we are going to do the outreach efforts, standing rule advisory committees and board standing committees and other approaches. So should I assume and goal is not to have the work groups, or you are saying that other approaches means work group in the rack?
I'm sorry, I'm not sure I understand the question.
So right now, before we make any major change on the rules, we don't have a rack, like that means rule advisory committee. Usually we have the work groups. So I just want to clarify the goals here is going to have rule advisory committee or work group, because we do work group. I don't I personally, and that's my opinion. I don't think so we should have a group for any major change on the rules. We should have rule advisory committee. So I just want to clarify.
Yeah, I would not be able to answer that directly. I don't know if any staff have a comment, or maybe we can get back to you. Um, I think the idea of this really is more that we're going to take a thorough look at that process and look at various solutions, but we haven't really defined what the specific solutions will be based on what's most practical, what's needed over the process or course of the rule revisions, and also the evaluation of the rules after they've been implemented. So I think it's intended to be not a, this is what we're going to do, but we're going to consider various choices. And in that, work groups, rule advisory committees, whichever approach, there may be cases where a work group is the right thing based on kind of where we are in the cycle of the rule revisions. But in other cases, a more formal RAC might be more in place. I think that's what I would understand here. And we're not trying to box in or specifically say we're going to do this, that, or the other. We're going to take the best action and use the right kind of input based on the need.
Thank you for clarification. Thanks.
Does that helps then?
Yes.
Okay, good. Other comments?
Member Doyle, I'm not seeing any other hands go up in the room.
Good. All right. So let's move on to our last pillar, communication. So this is an important area, obviously. First goal is to enhance communication and understanding across the practice of pharmacy to promote safe access to medications, equitable treatment, trust, and professionalism. And the actions here are to share and promote the board and governor's vision and goals as a foundation for alignment and collaboration with customers and partners, to expand outreach and networking with diverse organizations, agencies, and individuals to gain a deeper understanding of shared needs, identify opportunities for collaboration, and develop joint actions to achieve mutual goals. Evaluate the effectiveness of current communications methods and channels and identify approaches to boost the impact of our messaging. And review clarity and usability of frequently used public-facing documents and revise/improve them as needed to enhance accessibility and understanding. Second is to promote awareness and knowledge of rule changes and other board actions to support understanding and compliance. These include implement comprehensive pre- and post-launch communication strategies for rule updates targeting licensees, registrants, and other affected or interested parties. Establish accessible inbound communication channels to facilitate feedback and address questions on rule amendments. And 3, explore and implement more diverse and effective methods to strengthen communication and interaction between board and staff, ensuring clarity of goals, challenges, and decisions. And 3rd, develop a more responsive, service-oriented approach to providing timely and useful information to customers and the public. These include investigate and evaluate approaches and options for handling licensee and registrant questions while maintaining a clear distinction between providing information and offering legal advice. 2, identify and test various methods to enhance the handling of inquiries and evaluate their impact on customer/inquiry understanding and satisfaction. And 3, adopt effective response strategies while continuously evaluating their impact on compliance with regulation, service quality, and perception of the Board of Pharmacy. So a lot of stuff in there.
Member Emmons, my comment, remains the same. I just want to make sure it's on the record, for the communication section, that there is opportunities here to actually include in the key action items, equity.
Mm-hmm. Very good. Other comments? All right, so that's what we were looking to do. I guess what I would ask now, just in reflection over the full array of things that we've covered over the 6 pillars. Clearly, Board Member Hemmings has clarified and called to the attention the need to better make more visible and explicit the diversity, equity, inclusion, and belonging objectives. And as I said, I think that will be covered also in other parts, but I do see totally what you're saying about this piece too. So reflecting on what came out of the meeting, what you think, and we captured the idea of the technician training was not explicitly addressed here, but any other sort of general thoughts, feelings about how this would provide an expression of direction and priority for staff looking out over the next 1 to 2 to 5 years, as Executive Director Fox commented.
Member Joyce?
Board Member Joyce, I wanted to revisit Board Member Vipperman's comment about the pharmacy tech education. As we expand pharmacy services to allow for more technicians to do vaccines starting 1/1/24, to expand those services to technicians to be able to do that. And as we look into pharmacy technicians as being able to take verbal transfers over the phone. We are always looking for technicians to be able to do more tasks that are non-clinical. Pharmacy education should align with those changes. Pharmacy services are expanding. We need more techs to do more things. But then there's nothing that's addressing the education for those pharmacy technicians. Another thing is pharmacy tech attrition in the retail settings. A lot of them, technicians, there's a shortage of technicians in retail pharmacies, and there's a reason. The pay stinks, for one thing. And we need to look at some kind of incentive to get more technicians working in retail pharmacies. So that's why I think pharmacy tech education is important. Thanks.
Mhm.
Member DeBarmore?
Board Member DeBarmore. So not having participated in the strategic planning, you guys did phenomenal. This is awesome. I think we've come a long ways in the last couple of years, and this captures so much, I think, of what we talked about in board meetings and thoughts and frustrations and things we've expressed. So you guys have captured what I would have hoped to see. So thank you very much for carrying that forward and making sure all the elements are there. As far as technician education, I see it here. I see it here. It's just not called technician. It's called licensee. I think we need to ensure it's not just our technicians that are educated and competent. It's all licensees. It's the pharmacists too. It's the interns as well. So I don't want to shortchange your concerns, but I also want to make sure that it's not individual. It is all. As technicians are taking on more, why are technicians taking on more? Technicians are taking on more because pharmacists are taking on more. It's all the same spectrum. So I saw it in B2.
Mm-hmm. I
That's
would
what I
agree
see.
that was really the intent, rather than to, have a checklist, try to keep it at the level of this would be applicable to all licensees. So I think that does reflect what the intent of the goal here is.
Board Member Him? Member DeBarmore?
And as the board, it's our job then to make sure it's technicians that are included, right? To make sure that we're addressing your concern for technicians, right? And we're not forgetting. Thank you, sir.
Board Member Hemmons.
Member Hemmings, as I listened to Board Member Joyce, so equity, once again, was what I was hearing, right? In terms of sometimes, I know licensee covers, everything, but I think sometimes when we fail to call specific, licensees, probably in this case, out, where there are inequities, especially in that arena as it relates to pharmacy techs. It doesn't get the priority that it needs. And we see them all as one, and sometimes we have to look at where there's some inequities within the licensee area that may exist. And as I was listening to Board Member Joyce, that's what was just glaring in my mind was, as we look at this and we, create these goals, maybe as we look at equity issues, maybe there is room and maybe there's a need to specifically call out a particular licensee section. And I think that goes for, even as we create these rules and everything that we do, we need to consider, some of the differences and the nuances with pharmacy techs versus pharmacists, where there may be equity issues. So that's my comment.
Good. That's good input. Thank you.
Board Member Joyce.
Member Joyce again, thank you for that. Also wanted to address, enrollment in, pharmacy schools and the decline there. We are gonna be looking, in 5 to 10 years, probably to a strong, I'm sorry, it's gonna be, we're gonna have a work shortage that we probably can't imagine now with pharmacy schools being at 66% of what they were 10 years ago. And so I don't know how that's gonna fit in our strategic plan, because we have to prepare for that now. So I don't know if that would fit in innovation or operations, but I know that with innovation, we can, look to do a lot there with the use of technology and potentially AI to, ease our workload, to improve patient safety, because that's our goal. But we have to look ahead, and I just want to make sure we start looking at that now, because there will be a shortage of pharmacists in the next 5 to 10 years that we probably should be looking into now, while we're still ahead of the game.
I think, I don't think that was not at all a consideration in putting these together. And what the intent was to emphasize the role of the board of pharmacy, the Oregon Board of Pharmacy, is not to, we can't recruit people into the profession, but what we can do is working with partners, including employers, including education institutions and others, is look at ways that we can help them be successful in doing that. Or, so it's really got to be a creative process, that I think if you kind of read through this and think, okay, what can the board do to address that trend that you're describing? Well, it's kind of described in a variety of places here, but the idea that we've got a goal, like get more people into the pharmacy industry or the pharmacy profession is really not part of the charge of the Board of Pharmacy, but what can we do to address that potential issue? So admittedly, it's subtle, but it is a new direction in a way for the board to go there. And so we're trying to explore, not feel our way, but be more creative in how we can address that problem. But it's certainly intended to be incorporated into the various goals that are here.
Board Member Hemmons.
Member Clemens, Board Member Joyce, thank you for bringing that up, because I do remember that at the strategic plan, in November, we spent a significant amount of time on that issue. And, I may have missed it today as we went through this, but I didn't see a lot of that. And I understand that that would probably be a new role for the board. But even so, and maybe more so, because it would be a new role that maybe it needs to be specifically called out.
Mm-hmm.
Member Vipperman.
This is Board Member Bipperman. I just want to make sure the new people on the board. So when I was brought on to the board 8 years ago, almost 8 years ago, it was because there was going to be education formally in the state. That's why the 2 technicians were brought on. And then stockholders went to the governor's office and had that stopped. So that was not, it didn't go forward. We did have the national certification, which this board decided to discontinue in February of 2022. Because of shortages, shortages. And to be fair, it worked. We have 1,000 more technicians on the books now. I mean, it has worked. However, what is the quality of that education? That is my worry. That is, I mean, when I am here and looking for patient safety, and that is my worry, that's my ask, and that's what I'm gonna ask all the time, every time, is for patient safety. There's the training's not there. It is said that a pharmacist is training, a pharmacist is not training. A technician is training technician, and that technician could be 3 days old. That technician, they could be 2 weeks old, and that's how it is. So the fact that we would like to have a training that is okay with the board or state or whatever is not something that is new. We've been asking for a very long time. Okay, I'm done.
Very good. I appreciate their comments.
Board Member Hammond, just a point of clarification. Yes, I agree with Board Member Bipper, but what I was actually referring to was we spent a lot of time talking about how do we create pipelines, right, into the profession, into the field. And that's what I was saying, that's new as far as I know for the board, a new role that the board, if we decided to take that on, and therefore I felt it should be called out in the plan as it relates to, what is our role in terms of increasing the number of people within the field of pharmacy, whether it be pharmacy tech, pharmacists, or retail stores.
Mm-hmm. Well, I would just comment without, just as my best understanding, right? So don't take this as anything but, what I perceive is that is not currently a statutory responsibility of the Board of Pharmacy in terms of what's been outlined in state law. And that to go in that direction could require some maybe direction from the governor or a legislature, but in terms of influencing it through collaboration with other organizations, that is more in alignment with what the board can currently do. I'm speaking out of school a little bit, but I think, having worked with other agencies, we always say, to figure out what you're supposed to do, you look at the statute. And I don't think right now it's described that way.
Board Member DeBarmore.
Board Member DeBarmore, yes, but yes, that is true. It is not our role to necessarily assist in generating a pipeline, at least it has not been up to this point, but it is our role not to create barriers. It is our role to not take profession and to make the work sites so burdened with regulatory oversight that the practice is unbearable.
Right. And I
Pharmacy
think-
is one of the most regulated professions. And it's not just us. It's not just the state agency. There's so many more agencies, so many more regulatory bodies that regulate pharmacy, the movement of medications, the way medications are used, how pharmacists are involved in that, in the actual practice of the clinical practice of pharmacy. It becomes such a stressful place because there's so much to avoiding risk and to protecting a license that it becomes an unpalatable profession. And we can't impact that. We do have influence on that.
Executive Director Fox and Facilitator Pandy is absolutely correct on the statutory responsibility of the board. And I believe staff, we hear loud and clear on not where we are today, but where you would like to see this board go in the future as we look at the agency itself in the future. And so though currently from a statutory standpoint, I'll call it a pipeline project because that's what I'm hearing for the state of pharmacy, though we can't directly impact or influence indirectly through associations and our partners. And so what staff can go back and add something towards that piece on there so it's called out.
And also, I think what Board Member DeBarmore is saying is really where where we have tried to be very explicit, even though, there's a lot of words here, that what the Board of Pharmacy can do is look at the impact of regulations, look at the impact of the processes that we manage, look at the relationships that we build with other organizations, and find out ways that we can better eliminate barriers, improve access. And so, make the environment better through the things that the board does control. That's really perfectly within the current realm of responsibilities for the Board of Pharmacy, and that's kind of what we've tried to express in these goals.
Member Beaman?
Member Beaman, to expand on Board Member DeBarmore's thought and this whole approach to being mindful of we're really putting into rules too. I think because this is something that's not in our statute, and we always say neither is payment. But certain, and we've seen it from several comments, several times over several different rules, changing of slight words or changing of things, though it's not our intent, can change that payer's intent, and they can utilize that against our licensees basically, and thus stress the profession more by pulling payments or decreasing, or so that we're, and I know that's not our main concern, but how many times have we said that's what it boils down to? Why is staffing an issue? Because you have to have enough money to pay everybody. And if you're not getting paid because of, oh, the Oregon board changed this rule, that means we can say XYZ based on this change. Like, we have to really have open ears and listen to the people who know that side of things better than we might individually know that here, and listen to those statements, listen to those comments, because now more than ever, people are, and I'm so grateful for it, we're hearing from stakeholders so much more, and we hear it off over and over and over again, how these things will impact. And so we have the luxury of the experts saying this is going to be a big deal. And we need to really just be mindful of statements like that, because it'll affect the pipeline, it'll affect the payment, it'll affect so many things outside of what we're just trying to do. And a lot of the scripted stuff that we do doesn't, it's creating more barriers than we're intending to. So.
Member Patel?
Member Patel, well said, board member Debamar and board member Bayman. It is, and I do remember when I come on this board a year ago, and I also expressed my concern. It is the PBM issue, it is the reimbursement issue. I do remember everyone is like, that's not our problem, but I just attended the NAVP board member forum. They also acknowledged and they also discussed at the bottom line, this is the PBM issue, this is the reimbursement issue. And because of that, we are in this dire situation. If you talk about recruitment, yeah, well, all those interns, they come to the pharmacy and they're looking at that pharmacy, they're like sweating and always like worried about the license and the risk you have to take on your license. You are putting your NPI 600 to 700 times in 8-hour shift, right? And then we have so much regulation that you always worried about license. Like, do you really think that student wants to continue, or that student is going to tell the next student, yeah, you are making the right choice to go into pharmacy school? Probably not. It's, and you are right. You know, when we make the one rule change, it impacts payers. Because then payer tell that this is in your rule and I'm going to call back that money. And this is happening right now. And I just want to let you know, trust me, that Q1 2024, that I don't know if you guys know, double DIR apocalypse, it didn't even started. You are going to see more pharmacy closure. This is all related to that. That's the administrative burden, either board of pharmacies and the PBM issue or the reimbursement. Thank you.
All right, I am conscious of your agenda time, and so I think maybe the focus on any other comments in terms of the goals and actions present or missing that would help us move on. And I believe there might be a something for you to vote on as we wrap this up. So, Board President Doyle, is there a conclusion then that you have for this, or Executive Director Fox, any final comments from you?
Thank you, Facilitator Pandy. Members of the board, staff heard you loud and clear this morning with the items that you believe it is missing, that needs a little bit more massage in each of the pillars, from calling out specifically the technician education, calling out and embedding equity throughout the document and all the pillars, as well as expounding upon the board's role or staff shortage and a pipeline project in collaboration with partners. So is there anything that I'm missing from there, from a conversation we just had? Seeing none. The only thing that I would just ask President Doyle, if there can be a consensus of the board that the draft that's provided that we went through today is good for staff to continue to move forward with the inclusion of those 3 items I just addressed that was raised from the board. So staff can continue on this path to get ready for your February board meeting, where it would be more of an expansive strategic plan that would be coming forward to you, and you'll be spending several hours on the next strategic plan, because then we'll get into the equity statement, we'll get into more equity, we'll get into the values and some of the recommended changes within the values, and some other information as relates to embedding the governor's initiatives throughout as well. So with that, I yield back to you, President Doyle.
Um, President Doyle, under normal Robert's Rules of Orders, this would be a document that we would receive today. And then it would be a continuing iteration process of moving forward before the final vote for approval. So I understand and interpret your request now to acknowledge the receipt of the document that and that we're on the right track for the information that was presented and for the feedback that you had summarized at the end will continue to be worked on and incorporated into the document. So that is the motion that I am making for receipt of the document, that it's that the board agrees to move forward and with this document as written, including incorporation of comments received today.
10 seconds. Board Member Beeman, yes.
Board Member DeBarmore, yes.
Board Member Hall, yes. Board Member Hemmons, yes. I think.
Board Member Joyce, yes.
Member Patel,
Yes. Member Vipperman, yes.
Executive Director Fox.
You, President Doyle. And as was shared earlier, there's some comments around equity and some of the other items with staff shortage and technician education. If board members have certain language, if they could send that directly to me and work directly through me individually, not collectively in the email. But send it to me individually. That way I can work with the appropriate staff, our leadership team, as we continue to bring back a more refined product to you in February.
This Board Member Hemmons, I don't know if this is possible. Is there a way to have a Word document so it could be edited?
A Word document, share it with,
Yes.
Board Member Doyle, I believe she's asking for the Word document to edit to provide the feedback and language that you are requesting, rather than trying to summate in an email.
yes.
Member Hemmons, in terms of the time frame, is it okay if we get this back to you after the new year?
Preferably, yes.
Board Member Doyle speaking, facilitator Pandy or facilitator Sale, do you have any additional comments or feedback for us?
No, just thank you very much for your attention and the input. Good to know that we've, obviously the staff put a lot of work into this, as well as Executive Director Fox, that we're in the right direction, and we'll look forward to the refinements and your further feedback as we move toward the final plan. And Brittany's been, or facilitator Sale has been madly taking notes, so that's been her job. So we've captured everything that you've said. So thank you very much. It's great to see you all again, and appreciate your letting us join you remotely.
Yeah, facilitator say I agree with me. Nothing to add at this time. Thank you.
Board Member Doyle, thank you very much for your participation today. Have a good day.
Thank you.
Have a good rest of your
We are-
meeting.
Remember Doyle, we are at 9:44. The intended break time was at 10:05. Are we able to adjust the schedule to either move into executive session at this time or to take our break now and then move into executive session thereafter? Okay, so I'm receiving staff advice of taking a break now. But we may, is it correct that we may begin before 10:05? Oh, okay. So it just being a matter of just a few minutes, we will take a 20-minute break now, and we will motion to move into executive session at 10:05.